done to protect patients, Noah Nelson looks for some answers.
Though not quite 6 years old, Eric Haydendorf has already experienced a lifetime of medical problems. He was born prematurely and contracted a series of life-threatening infections while still in the hospital.
He had complete kidney failure, his liver went into shock, and the infection settled in his joints.
Eric's case is not unique. According to a recent report by the Centers for Disease Control, more than 2 million patients a year in this country get serious infections while still in hospitals. Treatment adds more than $4 billion to patients' medical bills, and each year, there are 77,000 deaths somehow related to the infections. Dr. Robert Gaines wrote the CDC report.
Studies have shown that approximately 1/3 of all of those infections that we've referred to could be prevented without doing any further research, by simply applying what we already know.
Most of the proven infection control methods have been widely known since the 70s. What stops many hospitals from using them is the cost. But according to the CDC, reducing infections by just 6% would save enough money for the methods to pay for themselves. One hospital that's been successful in reducing infections is Vanderbilt Medical Center in Nashville. The intensive care unit, state-of-the-art medicine. When infections spread here, often hospital workers are the culprits. A disinfectant soap dispenser is mounted at the door of every patient's room. Staff members scrub when moving between patients. Medical instruments that are not disposable are sanitized after each use.
Very good.
Dr. William Schaffner directs infection control at Vanderbilt. He says hospitals need to be more aggressive in dealing with the problem.
I think the central issue is to have some trained personnel who do surveillance, who look at what's going on in the hospital to make sure that their infection rates are as low as possible.
Like most Americans, Eric's parents never thought about the possibility that hospital treatment could be the cause of an illness.
I wish I would have known that hospital infections are there, and they're widespread. They're very common. They're more common than what they let out.
As he grows older, Eric will need a series of operations to straighten his legs. When he enters the hospital this time, his parents will be fully aware of the risks. Noah Nelson, NBC News, Atlanta.